Hello, my name is Deborah Crabbe, and I'm a cardiologist at Temple University Hospital. It comes up as a question often, when should you refer your patients with diabetes to see a cardiologist? As you may know, diabetes is a potent risk factor for the development of future cardiovascular illness. We know that diabetes confers the same risk as if someone who's already had atherosclerotic heart disease. So it's an important risk factor to work on with your patients. Within our specialty, there's many things we can offer to help you assist patients with this condition. First, we can be very good partners with assisting with primary prevention and achievement of LDL goals. It's been my observation that sometimes there's a tendency to underdose statins or to be dissuaded to adjust statin doses due to side effects. When we're dealing with diabetics, we want to achieve the targeted goals of therapy across the cardiovascular risk spectrum. They include good blood pressure control, statin therapy if needed in most cases to develop lower LDLs. And remember, we have a lot of drugs that we can use that are safe and effective to achieve those goals. PCSK9s are part of your armamentarium. Zetia is part of your armamentarium. And we have new lipid-lowering therapies that are on the horizon and will be available for use. The other thing is for secondary prevention. In patients who have symptoms, certainly, of coronary artery disease blockages such as chest discomfort, anginal equivalents such as shortness of breath, it may be wise to refer those patients over to see a cardiologist. And certainly, we can help reinforce some of the goals of therapy that primary care providers are trying to get through to patients, such as diet, exercise, and again, achieving blood pressure and other cardiovascular endpoints. In primary prevention, LDL goals are less than 70 milligrams per deciliter for an LDL for patients with diabetes. But if the patient has established heart disease, we're driving that LDL down to less than 55. So my pearl is, don't give up on the statin. If you need help, send them to a cardiologist. That's what we do.